lot of Latinos. Statistics, research showing how prevalent and unfortunately higher, definitely in El Paso and here in the Valley, mental health issues are, especially like depression and anxiety.
Low health literacy costs about $7,500 more per person per year. So how many of you guys want to pay $7,500 more per year for health care? No.
This is about what do you know about navigating this new healthcare system you're in.
Today's conference on health literacy was very well received. It was very apparent to me that the people working in this community and the people in this community are very hungry to hear more about this topic. When people don't understand the health information that they're receiving, it can impact health outcomes.
And that's as doctors, that's what we care about most. We want to treat our patients and we want to ensure that the intervention or the treatment we're prescribing results in increased health outcome. In other words, we have resolved or we have improved their health care. And when they go back, i.e. the patient is they, then they're able to then actually be advocates on behalf of health literacy because they're saying, I understood my doctor. We as physicians will say, I know my patient is understanding what we're working on together. And together, we will actually have good health outcomes.
So, providers, those of you on the provider side.
We can create a new culture of diabetes education, caring for our patients with diabetes, if we understand what they value, if we understand their individual needs and culture, then we can center our education, our messages to them about their health towards their needs. And once we understand what somebody values, then we can explain their health to them in a way that is meaningful to them.
To put in place health literacy efforts, to put in place plain language, to have Dr. Wagner look over their materials and make them more readable for people.
Coming to a conference on health literacy helps you really understand in an application format how health literacy concepts such as cultural competency, cultural humility, plain language, teach back, how all of these tools that are related to helping patients understand and really apply health information at home.
So the information imparted to them through health literacy allows them to be, in today's lingo, better consumers of health.
I thought maybe I was going to hear the same information that we've heard before, but this was a very eye-opening experience.
We've talked about key communication strategies, and each of you have that. Timely, clear, correct.
If we can just help providers during their training years while they're forming their professional identities to be aware of health literacy and that there's reasons behind why people may not be adhering to their medical medications or instructions.
As you know, right now in my first year, I'm sort of in the midst of learning about all of the pathophysiology and the pharmacology, but if I can't communicate that information to patients in a way that they will understand, then it's not, going to be as useful as it could be.
Non-native speaking English population, especially with diabetic care. That's a huge issue in Texas and in the Hispanic community and in the community that I serve. So I think that trying to just reach more people, but reach them more where they live. So doing what we've always been aiming to do, but do it with more vision and with more efficiency.